how to perform CPR on a baby. We follow the same protocol as adults and youth people. So, doctors ABCD. First, in danger, I'm putting my gloves. In response, I will try to evaluate if the baby is responsive. I can try to call him, but if he doesn't answer, I will try to tingle the feet like this and like this, trying to provoke some reaction. If the baby is not responsive to any of these stimulus, I'm considering the baby unconscious. Then I need to gently open the airway and try to assess for breathing. In 10 seconds, if I do not hear or feel any breath, I'm considering the baby unconscious, not breathing, so I need to immediately start CPR. When performing full exposure of the baby's chest, I aim for the line between the nipples in babies, and CPR there is performed with 2 fingers. I can either do like this, or I can use my thumbs, but again, in the line between the nipples. In CPR with babies, it's the same as CPR with young people, so I again have to put something on his mouth, and I need to start with 5 rescue breaths. The interesting detail here is that whenever I'm performing rescue breaths on a baby, I need to cover both his mouth and his nose with my mouth because they're very small. And now I'm covering all this area, so I don't need to pinch the nose. And the other detail is when I'm making the rescue breaths to a baby, I will not use the full volume of my lungs. I will use only the volume of my cheeks. This is enough to make a rescue breath on a baby and to not make a barotrauma if I use all of my volume. So I'm starting with 5 initial rescue breaths by opening the airway, then I've started to perform chest compressions. The ratio is again 30 chest compressions, 2 rescue breaths, 30 chest compressions, 2 rescue breaths, with the rate of around 120 per minute. Okay. 30 chest compressions, open the airway, 2 rescue breaths, and then again. I do it until someone comes and switches with me, until the ambulance arrives, or until the baby returns license. How to use AED on babies? Usually most of the AEDs have specific pads for babies, and the detail here is that you cannot put the pads like you put them on adults because you can see that there is no place between them. So the thing that you should do is place one pad in the front of the chest and the other pad on the back. This is how the heart of the baby stays between the pads, so when the electricity runs between the 2 pads, it shocks the heart and restarts it.